Can endometriosis be cured? Endometriosis has this tag of being a chronic disease that has no cure, which leads to a fallacy where practitioners tell patients that why do surgery if it's going to recur anyway. This leads to a lot of despair and bashing of hope for unnecessary reasons. If you consider cure by its clinical definition, which is removal of disease and absence of symptoms, then that is achievable, but it is very difficult to do. Considering the surgical technicality and expertise needed to do surgery for this disease, it is one of the most difficult surgeries any surgeon can perform from head to toe. That's why the skill set required to this is very limited. I can count up to 50 surgeons worldwide who can handle advanced endometriosis for an estimated population of 240 million women with this disease. In that sense, general gynecology believes that there is no cure for this disease, and that's why there is this push towards pharmacological intervention all the time. We need to understand that pharmacological intervention is not a treatment of the disease, it's a treatment of symptoms. No pharmacological method, which is a drug or a pill or an injection, is going to claim to remove the disease. It is only going to help with endometriosis related pain. So as we know, in expert hands, recurrence rates can be extremely low, 3 to 4% for deep disease, 10% for ovarian endometriomas. And we know that fibroids have a recurrence rate of around 5 to 10%, but you never hear of fibroids as an incurable disease. So endometriosis still undeservedly gets this tag because of the inability of the generalists to excise all the disease and achieve these kind of low recurrence rates. The problem comes in similar to what we had in ovarian cancer back in the day, where we found that when there were centers of excellence with multidisciplinary teams for ovarian cancer, survival rates over 5 years went up quite dramatically. Similarly with endometriosis, which is probably a harder disease to operate on than some ovarian cancer cases, benefiting widely from a multidisciplinary approach, multidisciplinary teams and centers of excellence, which is not only going to improve long-term recurrence-free periods for patients, but also improve surgical excision, identification of all types of lesions, and dramatically improve outcomes in terms of pain scores as well as fertility outcomes. So the average multidisciplinary team will obviously involve gynecology, led by a specialist in endometriosis, colorectal surgeon or a general surgeon, cardiothoracic surgeon or a general surgeon with experience in thoracic surgery, urological surgeon, and specialist anesthesiologists to deal with long, prolonged cases and special equipment like robotic surgery. Then apart from the surgical branches, we also have fertility specialists to help with that is needed. We also have pain management specialists, as well as holistic care involving nutrition and physiotherapy, which plays an important part in preparing for surgery as well as recovery from surgery.